going on, guys? My name is Dr. Brandon Welch, also known as the Pharmacy Athlete. I'm a clinical sports pharmacist, and I'm the host of the show, the Sports Pharmacy Network, and really just wanted to drop an introduction on the human performance topics we're going to be discussing throughout the series of episodes that we're going to have on this show. So our overall mission of this show is to really provide an interdisciplinary approach of scientific and clinical knowledge to optimize athlete health and human performance through collaboration and innovation to make an athlete perform at their best. So there's so many different components and aspects of athlete performance, right? So we have strength and conditioning, we have movement, we have technical skills, we have nutrition, metabolic health, recovery. The list can go on. And the way that I look at this is, how do we continue building a robust team of sports scientists, so an ecosystem of experts to deliver peak results? The clinical sports pharmacist is a new and emerging role that can provide extensive value to an athlete's performance and health. Some of their duties and responsibilities can easily consist of clinical lab testing, recommendations, and interpretation through a collaborative practice agreement with the sports medicine physician. And so whenever we think about biomarkers, right, this really allows us to dissect what can be going on in the inside that can be impeding or impacting an athlete's performance. And so for example, oftentimes when athletes have their physicals, they do typically a complete blood count, which is called a CBC. They do a CMP, a complete metabolic panel. Sometimes they'll do a lipid panel. We'll order a thyroid panel, and then we'll order sometimes testosterone. So a lot of these labs allows clinical sports pharmacists to provide a complete picture of an athlete's overall health and work collectively with the sports medicine provider and the athletic trainer on how to periodize an athlete's training load, or also work with a nutritionist, right, to how to better periodize their nutrition. Sorry, tongue twister. Also, we don't want to deviate from what we went to school for, right? Which is medication therapy management. So athletes are humans too, right? So athletes suffer from different health conditions and they take medications. So how does a clinical sports pharmacist individualize and select medications based off the kinetics and dynamics to reduce the side effect profile? And so when I say kinetics, I think of the acronym ADME, right? So absorption, distribution, metabolism, and excretion, right? So how do we look at the kinetics to help reduce the side effect profile where it's not impeding on their performance? And so the same thing is with evidence-based supplements, right? Understanding how to do that clinical research and understand how different supplements are metabolized. And with clinical sports pharmacists, they have the ability to understand WADA, the World Anti-Doping, and what substances may be banned or illegal. And if so, where there is a medically necessary condition, such as an athlete suffering from ADHD or performance anxiety, right, where often propranolol is used, they can assist the sports medicine provider with what's called a TUE, a therapeutic use exception report. Then also, when we think of orthobiologic therapy, this is completely investigational, but it's growing and it's working, right? And so oftentimes people look at it as anecdotal. So when we think of platelet-rich plasma, stem cell, amniotic injections, hyaluronic acid, right? So when an athlete gets a bad knee injury, we need them to recover quickly on the field. Well, there's certain supplements and medications that need to be suspended in order to optimize that procedure or therapy, right? And so building those protocols are going to be essential. And so when we think about this consortium or this web, like, you see how a clinical sports pharmacist can be of need in assistance with working with the athletic trainer, physical therapist, sports medicine provider, strength and conditioning coach, the nutritionist, right? We're all in that same wheelhouse and we're all on one team to better help the athlete create longevity to their career and optimize peak performance. So we really want to continue to dispense the science of elite human performance. Myself, and all this information that I'm spitting out to you guys is based off of what's actually been done. So I currently work in a sports medicine practice where I do a lot of these responsibilities and duties that I've listed off. And we've seen, really good value from it. And so this isn't some theory or some folktale. This is real life stuff. I work with athletic trainers. I work with physical therapists. I work with sports medicine providers. And so I really think it's important to heighten the awareness of how a clinical sports pharmacist can fit into the mix to deliver peak results for the athlete. All right, guys, keep following us. We're going to have really good human performance topics throughout the series of the episodes that we release. Like, subscribe, and let's get it, guys. All right, let's keep taking our game to the next level. Again, Dr. Brandon Welch, also known as the Pharmacy Athlete. Let's get it.